Hey everybody, it's Dr. David, the ENT doctor again. I'm going to talk about iron, and I'm going to talk about it in the context of iron deficiency that can show up most notably in children who are having problems with their breathing at night. So I think the first thing to do is talk about how iron is important and how it gets through the system. So iron is a dietary requirement. It's the only way we can get iron is by consuming it. And the food that sticks out amongst the crowd is meat. So meat is the main dietary source available to us with respect to iron. There is iron available in other vegetables and so forth, but if we look at where the main source of it is meat. So just bear that in mind as we work through things. Once you consume the iron by whatever means, you need to absorb it. And one of the things that helps iron get into the system is vitamin C. So often if someone is iron deficient and we suggest an iron supplement, we'll also recommend they take it with some vitamin C of some form as well, because that improves the absorption. And what absorption means is basically the body's, or particularly the gut's ability to drag the iron from the food into the system. Once it's in the system, the big thing that iron does, it does lots of things, but the big one is that it relates to the formation of red blood cells, and that then carries oxygen through the body. So the next thing then that can have an impact on your iron levels, okay, so we've got intake, absorption. The other one that can have an impact is demand. Now, demand is usually pretty stable. It does go up with women with pregnancy because they need to make more red blood cells to float around as part of the pregnancy thing. So that's obviously a little bit of a unique situation, so and obviously not relevant to children. Then the last one is loss. So you can, if you're losing blood for some reason, which again, women will appreciate that situation, but there are other reasons that you could be losing blood that can deplete your iron stores. So you could be losing blood, for example, if you have some sort of bowel problem, if you have some form of cancer, you can be losing blood as well. You have a kidney or what we call a renal problem, where you're losing blood through the urine. So that's sort of just a rough outline for you all. So let's talk about how this works in children. So we have the setting, so you understand the context, of a child that has some form of upper airway obstruction, whatever it is, and that leads to a breathing problem whilst they're asleep, and hence we use the term sleep disordered breathing. When they have sleep disordered breathing with the obstruction, there's a whole lot of other things that can go on at the same time that can conspire against the system. So the first one is, for example, if they have big tonsils, the physical ability to shift something like meat through past those tonsils can be compromised. So you may have a child that will chew and chew and chew on meat and then spit it out because they've worked out it's too hard. The other thing you may have is that if they have a nasal obstruction, for example, and they have to breathe through their mouth because they're just so blocked that that's really their only choice, then they will prioritize breathing over swallowing. So again, if something has to go into the mouth and they have to chew and chew and chew and get it through, but in the meantime they're trying to breathe at the same time, they're going to, again, avoid stuff that makes breathing tricky. So again, that's where meat tends to sort of fall off more than anything else for that reason. The other thing that ties in with this is that when you have some form of obstruction, particularly if it's affecting the nasal passage in some way, that alters your sense of smell. And we know that children with sleep disordered breathing have an altered perception of olfaction, of smell, and that this seems to have an impact then on food preferences. So again, certain types of foods get pushed to the wayside. And collectively, with all of that going on, one of the things that they have an affinity for, a proclivity towards, is milk-based substances or substitutes, because it's easy and it's quick to get down, and the parents can, load them up, with, like smoothies and milkshakes, and it's just like, at least they do that. It's like, all good intentions with regards to doing that, but that can actually lead to a few problems. The first one is that there's pretty much no iron in milk, so you're actually not getting any iron in there. And the second thing is that it can have an impact on, especially in very young children and infants, and you shouldn't be giving normal milk to infants at all, because the system's just not set up for it. And then even in children, you need to be mindful of how much milk they're having, because again, that can have an issue, and I'll go through that, because that brings us to basically absorption. So within the gut, there's the lining of the gut has little bits and pieces here and there that are designed for pulling the nutrients out of the food that we consume. And if there is some form of inflammation to the gut, then that does have an impact with regards to how the gut works. And as a consequence of that, they may not absorb it. Even if they're consuming it, they may not absorb it. So when you have sleep disordered breathing, that's an inflammatory condition. That inflammation impairs absorption of iron. So that's our next problem. The other thing is, if, for example, they're consuming milk, then that milk can actually cause some inflammation to the gut, impairs absorption, but it can also cause a little bit of bleeding, and that obviously then relates to losses where with that bit of bleeding they're losing a bit of blood, which means they're losing some iron with it as well. So the consequences that we have with all of this is that we have children that have airway obstruction, who are already tired because they're not breathing properly, who then are drifting into iron deficiency. And with the iron deficiency, they then have a compromised ability to make more red blood cells, which is exactly what they need to do to compensate for the low oxygen levels, to try and increase their oxygen carrying capacity. So in fact, their demand has increased, but their ability to meet that demand is compromised. So it actually is a little bit of a double-edged sword. And as a consequence of that, they then struggle even more so, and are even more tired. And this is where the problem lies in, because everyone will see that they're not breathing properly, not sleeping properly, and that the child's tired, and they'll miss the iron deficiency as part of it. The other thing that's really interesting is that having iron deficiencies can be a trigger for things that are also tied in with low oxygen levels that we see in sleep disordered breathing. So for example, a really big one is teeth grinding. So children that are teeth grinding at night will not unusually have an underlying breathing problem where their oxygen levels are dropping down, their brain is getting anxious and stressed because of those low oxygen levels, and then they go into the teeth grinding. But having low iron levels can also do it too, because iron seems to play an important part in some of the neurotransmitter and brain function. And if you're low in iron, then that can also trigger teeth grinding too. So what do? So as always, don't ignore the snore, and for that matter, mouth breathing too. Obviously, stopping breathing at night is just really concerning. So you need to address any underlying sleep disordered breathing issue. But then you also need to make sure that nothing is missed. And if there are issues with iron, then you obviously look at what's going on with the diet. And if it's more an absorption problem, then you sort of just try and improve things by, again, looking at the diet, but then looking at supplementation, iron, vitamin C. Now, supplements are not things you want to go on just for fun. They're things that you want to really be on because there is a noted deficiency. So that does involve a blood test, and that obviously can cause a few challenges in its own right. So for children that I look after, for example, where we know they're going to surgery, then we say, look, let's get the blood test as part of the operative procedure, because they're asleep, under an anaesthetic. We can take blood relatively easy because we're already accessing them with an intravenous drip. We can take blood at the same time, get them tested, and then go from there. The icing on the cake is that when we manage sleep-disordered breathing, the research shows that the iron deficiencies start to improve and resolve. So the actual treatment of the sleep-disordered breathing actually then starts to alleviate the iron deficiency. So there you go. So hopefully that's useful. A little bit longer than my usual talk, but I just wanted to make sure I covered everything to the best of my ability. Thanks very much. Bye.